Welcome everyone to our webinar today, and we are the New York State Office for New Americans based in Center, Utica, New York, and I'm Alicia Baranova, the project coordinator of the program. And today we are holding a webinar in collaboration with Mohawk Valley Health System and Oneida County Health Department. In today's webinar agenda, we will be covering COVID-19 symptoms, home safety, safety measures, testing sites, and any resources related to COVID-19 and other. And Dr. Ken Hall, the Chief Physician Executive at Mohawk Valley Health System, and Krista, who is the Public Health Educator at the Oneida County Health Department, will help us with that. And just a few reminders before we get started. Please feel free to ask any questions at any point during the presentation, or you can put them in the chat box that is located on the bottom of your screen. And with that, we will open today's webinar, and we are very lucky to have with us Dr. Ken Hall, the Chief Physician Executive at Mohawk Valley Health System. And with that, I'm going to hide myself and mute myself and introduce Dr. Hall to the floor. Welcome, Doctor.
Thank you for the welcome. I wanted to say hello to everybody, and thank you for allowing me to participate in this. So there are some things that I think everybody should know about the SARS-CoV-2, which is the name of the virus that causes COVID-19, which is the name of the disease. First, I think it's important that we use similar naming, because that allows people to understand exactly what we're talking about. So, there's a lot of, there's a lot of information out there, and so people don't necessarily fully understand or are able to, condense it down to what they think, or what they think that they can use in their life. So that's what I really wanted to talk about today. So the first is, what is it that you can do to protect yourself from being infected with this virus and developing the COVID-19 disease? So, there are really things that are fairly basic that I think most people hear about most every day. The first is that, you want to protect yourself from droplets. So droplets are the small pieces of liquid that come out of your mouth when you cough or sneeze or even talk. And the smaller that they are, actually, the longer that they last in the air. And so the more likely you are to come in contact with them. And so things that you can do for that are, number one, you can stay away from people, which is why you hear about social distancing, or people staying away from each other about 6 feet or more, because 6 feet has been found to be a good distance where the chance of getting infected goes down significantly when you're that far away from somebody. So the other thing is wearing masks. So understand that when you wear a mask, you protect yourself a very little bit, but mostly you're protecting other people. Because as I said, when you're speaking, and certainly when you're coughing or sneezing, then small droplets come out of your mouth and out of your nose, and the mask will protect other people, because it basically holds them within the mask. So I think that that's a really important thing. Understand that the virus can live on surfaces, which is why it's important to do good hygiene. So that's not only personal hygiene, which is washing your face, washing your hands, but also hygiene around where you are, which is, washing surfaces. So washing your hands is really very simple. It's really soap and water. If you have the availability of having some of these alcohol-based sanitizing things such as Purell or something like that, then that also works. But if you don't, then soap and water works just fine. The same thing for surfaces. So the virus lives for some period of time on hard surfaces like metal or wood or plastic or things like that. It's really not clear at this time. Science doesn't have a good understanding of how long that is and how long the infectivity is based on how long it is there. But it's always good to be safe. And so certainly cleaning those surfaces, I think, is very important also. You know, the other thing is that, you know, we think about washing our hands and things like that, but the reality is that that the other thing you want to make sure that you're doing is not touching your face much with this. And the reason for that is because you can transmit the virus if it's on your hands up to your mouth or your nose or your eyes. It can come in through your eyes as well, really through any mucous membrane. And so you want to protect yourself from that as well. And actually there's some information, some data out there that supports that one of the ways that masks really benefit the mask wearer is because it keeps them from touching around their nose and around their mouth. And so that's something for you to consider as well. So if you should contract the disease or if you should get infected with the virus, then what kinds of things are you going to experience? So first, I'm sure many people have heard that a fair number of people, probably the majority of people, have very minimal or no symptoms at all. Which is good. We certainly hear about the bad cases, the people that end up in the hospital or in the intensive care unit, or unfortunately some people who die. But really the majority of people get a relatively minor symptom complex. And so what are those things? So what are the things that you should be looking for? So, you know, runny nose, sore throat, cough, fever, throwing up or diarrhea, so vomiting or diarrhea are probably the ones that people hear about the most. One of the more interesting ones that you hear about once in a while is that people will all of a sudden lose their sense of taste and smell. So they'll be going along and then all of a sudden they can't smell anything, or it's significantly diminished, or when they taste food, it doesn't taste like anything. It's very bland taste or almost no taste at all. So those are symptoms, and those can actually be the only symptoms that you can have that would indicate that you have the infection. So I think that those are things that people should be aware of and understand. So, you know, the other thing that people often ask me is, so when should I go to the doctor? Or even more fundamentally, when should I be tested? So we don't, you know, especially with what's going on in the country now, we don't want to be using tests unless we really think that they're going to benefit the person. And so we don't recommend people just go out and get a test just to get a test. The question that we always ask is, what are you going to do with that information? So if you're feeling well, then really, and you're doing what you should be doing in terms of, as I said before, wearing a mask, social distancing, those kinds of things, then that's really good. You know, if you're starting to feel sick, so if you're starting to have any of those symptoms that I talked about, fever, cough, shortness of breath, vomiting, diarrhea, or change in your sense of taste or smell, then you should be tested to see if you might have the disease. So why should you be tested? You should be tested not necessarily because you need to be admitted to the hospital, we'll talk about that later, but because actually because then if you do test positive, then it's even more important that you stay away from people, that you actually quarantine yourself, because you don't want to be infecting other people. So, you know, what would make you decide to go to the hospital? What makes you say, you know, I have this disease and I think that I should see a doctor? Well, you should see a doctor if you're feeling so sick that you don't feel like you can take care of yourself at home. So if you're very short of breath, so much that even getting up and walking across the room, you know, makes you very short of breath, makes you feel like you need to sit down, then that's something that you should go and see the doctor for. If your fever is so out of control that when you take ibuprofen or acetaminophen or something like that, and it doesn't control it, then you should go and see the doctor. If you're throwing up so much that you may end up being dehydrated, then you should go and see the doctor. Those are things that really require, more advanced care. So that's what I would say about going to see the doctor. So if you are sick, most important thing is if you're sick but not so sick that you feel like you need to see the doctor, then the most important thing is really to stay at home. So what does that mean? So you need to stay at home and you need to protect other people and you need to monitor yourself. So you need to separate yourself from other people. You need to not be around your friends, your family, neighbors, because you don't want to make them sick. You also want to make sure that you're wearing the mask. The mask needs to cover your mouth and your nose. It really needs to cover anywhere that you exhale through. And so you want to make sure that it is a good barrier across those areas. Obviously, you want to make sure that you're covering your cough and sneeze. So this is above and beyond the mask. You still want to make sure that you're coughing or sneezing into your elbow or something like that, so that you're not spreading those droplets. Because if you cough or sneeze, then there's more force, and so that even with a mask will allow some of the droplets to be expelled through. You want to make sure that you're cleaning your hands often, just as I said. So, it's not just, when you wake up in the morning, but it's really almost any time that you're doing anything or touching any kind of surfaces, you want to make sure that you're covering or that you're cleaning your hands. You don't want to be sharing personal items. That's very important that you minimize the opportunity for the spread to be done that way. And you want to be cleaning what are called the high touch surfaces. So, tables, chairs, anything, banisters of stairways, anything like that where you could actually, be touching things, and then other people naturally touch them too, because they end up supporting you or things like that. It's just very important that we keep those things as clean as possible and as virus-free as possible. So those are probably the main things that I would say are really important for people. There are things that are related to age. So obviously, as we've heard, this disease is much more serious for people that are older. It's also much more serious for people that have other illnesses. And some of these may be illnesses or conditions that you don't normally think of. So one of the things is that if you're really overweight, that actually is much or has been shown to actually be much more of an indicator of having severe disease. So you want to be very careful around people that may be a little overweight. Certainly people that have diabetes, high blood pressure, people that have things like cancer or other things that can affect their immune system or their ability to fight off infections. Those are all very important things to note, so that you can say that's a person that's more at risk, and so I really need to be extra careful around them. Those are probably the main things that I wanted to talk about. I'll be glad to answer any questions either now or at the end of the end of the conference. So thank you.
Thank you, Dr. Hall, for providing us with this information. And if anyone has any questions for Dr. Hall, this is the time to ask. You can unmute yourself and speak directly to the doctor, or you can put them in a chat box, and we will address them at the end of the presentation. And as of right now, I do not see any questions coming in. Still, if you have a question for the doctor, please go ahead and put them in a chat box. Dr. Hall is going to stay with us for the full presentation, so we will get back to it. And with that, we will move on to our second part of our webinar. And now I'd like to welcome Krista Dark, Public Health Educator at Oneida County Health Department. Krista, welcome.
Thank you.
Mhm.
Good morning. Thank you for having me. Can you see my screen okay?
Yes.
Okay. So what the topics I wanted to cover for today include um, we're going to talk a little bit about infections, just some activities in the community, information on testing, what to expect, where to go, things like that. Give you some additional resources to help you through this, and also some information on how to support your well-being. So I just wanted to mention, we just heard a lot about, the virus and how it spreads, and that's information to keep in mind when you're thinking about some activities that you or your family members that might contribute to increasing your risk. And, we've heard about the close contact. So overall, if you have larger number of people living together, visiting other families that may live close by, or, in an apartment close by, that interaction when you're within 6 feet will increase your risk. Also participating in activities such as family get-togethers or dinners or celebrations, generally those all would be considered close contact and would increase your risk of either contracting the virus or spreading it. Also, people that work together in a facility or commute or drive together to work, it also is considered close contact. It could be an activity to contribute to infection. So these are some of the things to think about to be able to reduce the risk. And we talked a lot about the staying 6 feet apart and how important it is to prevent the spread. And the doctor mentioned this previously, just a reminder that, even within your home, if somebody is sick, to keep as much distance. But as we know, also when we're out in the public, even if we're outside, it's important to keep that distance of 6 feet or about 2 arms length, really to help stop the spread of the virus. I wanted to talk a little bit more about testing and the testing that is available to you. If you are sent for a test and it's the viral test, it's testing for the virus, it's going to tell you if you have a current infection. So just something to remember, because there are other tests available. And we kind of heard many of these points before about reasons that you might get tested. Of course, if you're having the symptoms, if you know you've been in contact with somebody that has COVID-19. Again, if you have if you're older or you have other health conditions, best to talk with your healthcare provider about getting tested. If you do test positive, or you're in close contact with somebody who's tested positive, the health department will call you and talk to you to follow up and give you information about what you need to do for the next 10 to 14 days. So testing is important, and as was mentioned, it's important to know if you're sick, to know if you have the illness, because you staying home and staying away from others, even your family, helps prevent the spread to other people. It helps prevent it if you can take those precautions at home. So it is important, if you're sick, to know if you have the illness. We're going to go over some of the testing locations where you can go. You can find this list online, and you can also call us at the health department, and we can give you information on what might be convenient for you, a place for you to go to get tested. Just wanted to talk a little bit about the testing. The testing is safe. The stuff used for testing is very clean. Getting tested does not make you sick. There are places where you can go to have a free test done, where you're not going to have to use health insurance. Some places locally are doing the testing, but we would recommend that you call these places first to just to understand whether there's going to be fee or insurance. But the New York State testing sites are free if ordered by a healthcare provider. And you can see the number here. There's a testing COVID hotline where you can call to set up the appointment. And these test sites run by New York State, there's never a charge, and you don't have to use your insurance. Here we have two places that you can go for free right now, and things with testing are always changing, so it's good to call ahead and again contact us at the health department. We can give you the most current information on where to go for testing. But right now the Rite Aid on Commercial Drive in New Hartford is offering free testing. You do have to make an appointment online ahead of time and just answer some screening questions through the computer. And also there's a drive-through testing site, the state site at Griffiths International Airport in Rome. You also need to make an appointment for that, and you can make that by calling the toll-free New York State number. And again, these are free and you don't need your insurance. You just need to, answer some questions, provide them some information, and make an appointment ahead of time. Other areas, there's some urgent cares offering some testing, but these we definitely would recommend that you call ahead of time to just so you make sure you know before you go about your insurance being billed and any fees that you may have. And then here's just contact information for local facilities that you would want to call about testing options. And of course, your own primary care physician is good to talk through whether you think you need to be tested or to help point you in the right direction. So I just wanted to go over just some information about what you could expect at a testing site and a little information about what is entailed in the testing. So this shows one type of testing, which is a self-administered testing. These are just some images to kind of give you an idea of what the process is. And this is an observed by a healthcare provider testing. You can see where it starts with the cotton swab is in a sealed package that you open yourself, and then you do the swab yourself inside your nose, put it in a container, and send it back through to the pharmacist. It's observed by the pharmacist. Other locations are done by a healthcare provider, again, using the swab in a little different manner, but that is something that is only done by a healthcare provider. They, collect the sample, and then you will hear after the testing, while you're waiting for your results, very important, as the doctor mentioned, if you're sick, you definitely would want to stay home until you get your results. Yourself, you will be getting a call from the health department just to talk to you again about your isolation and what needs you might have, and to talk through with you to identify any close contacts you've had. So, maybe places you visited in the recent days, and other people that you've come in contact with. Important to mention too, if you test negative, if you're waiting for results, your tests come back, we still want you to continue to do things to prevent infection. The keeping your physical distance, the 6 feet, the washing the hands, the wearing the mask. But if you got tested because you were in contact with a person known to have an infection, you still need to quarantine for your 14 days, even if you're feeling well. Your test comes back negative. So it's just important to understand that, even though you feel good, you're still at risk of getting the disease because it can take up to 14 days. So again, the health department explains the need for the quarantine and the isolation. But just wanted to mention that because even if you're negative, you still need to quarantine for up to the 14 days. And throughout all of this, we just want to mention how important it is to take care of your health and your behavioral health. Um, it's expected, people will feel anxious, worried, or have fears. This is a typical reaction. We just like to stress how important it is to, keep up to date with the information, participate in activities like what we're doing today, get information from credible sources. I have a few listed here that you could start with. And it's also important though not to have too much exposure to news. You want to take a break from watching and reading news stories, and take some time away to avoid too much exposure to all of this information. Um, and avoid staying up late to watch the news. It's very important to get adequate sleep, and if there's stressful information and you want to improve your well-being, it's best to get the information you need in small amounts. Make sure you have what you need. Take advantage of the community resources that we have. Especially if you're in quarantine or isolation, you will be provided, information on how to make sure you have what you need. If you can get outside, if you're in isolation or quarantine, it's a little harder. You are at your home in your yard, but there are some things that, you can get outside and still keep a physical distance from other people. We encourage you to talk to your healthcare provider to help promote your well-being. Don't be afraid to ask questions. When you have answers to your questions, it will help reduce your stress and anxiety level. And we understand during now it's challenging to stay in touch with family. We can't be physically close, but it is really important to stay connected virtually and use, the electronic means that we have to connect with your friends and family. And then also the kids, wanted to mention some activities for kids. If you are, in the home and you're looking for things to do inside, perhaps you're in isolation, quarantine, there's quite a few resources out there, and more now than there were before, because a lot of the educational institutions have put things out during this time. The education department, there's different things, and I have some resources listed here where kids can do virtual field trips, they can do games online, they can interact with, National Geographic has a lot of resources, different things for kids that would help, if you're stuck inside and you have access to the internet. These are some places that might help you through that. Again, if you're able to get outside, that is helpful too. And lastly, I just wanted to list some additional resources of where you can find help. Oneida County has a coronavirus, a couple of resources for you, information lines that can help you with different needs during this time, and also our information, just general COVID information helpline is available. I've also listed the New York State Emotional Support Hotline that's available to you for mental health counseling if that's necessary during this time. And we have many different resources and way to connect you on our website. So please feel free to call our information lines and we will connect you to the necessary resources. Thank you.
Thank you, Krista. That was very informative. And does anyone have any questions to Krista or Dr. Hall? Okay, and as of right now, I don't see any questions coming. I just would like to take a moment and thank you, our guest speakers, for their time and the great information. Thank you, Dr. Hall. Thank you, Krista. We are looking forward to working with you in the future. I hope everyone has something to take away with them today. And I just want to take a moment and remind our attendees that COVID-related information in various languages can be found on our website, which is www.thecenterutica.org, or on our Facebook page, facebook.com/thecenterutica. Again, thank you everyone for joining us today, and I hope you enjoy the rest of your day. Stay safe and healthy. And we are the Office for New Americans, and I'll see you next time.
Thank you.
Thank you.
Yeah.